If you have hypermobile joints, you may have been told before that you're very flexible or that you're double jointed, but you may also know that there are problems that come with having hypermobile joints. So in today's video, I'm going to talk about what hypermobility is and share some tips can reduce the pain and irritation that you have as a result of your hypermobility. Now, just a side note, I'm not going to be talking about Ehlers-Danlos hypermobility in this video because I want to do a separate video on it, because Ehlers-Danlos is a systemic connective tissue disorder. You can be hypermobile or have a hypermobile joint and not have Ehlers-Danlos. So welcome. My name is Katherine. I'm the founder and principal therapist of LSM Clinic, sport and remedial therapy clinic in East London. In this channel, I share information about how the body works and tips and things that I found useful to help you live pain-free or as close as possible. So first of all, what is hypermobility? When I say hypermobility, what does it mean? Now, a lot of people will have referred to that as double jointedness and or like being really flexible. There is a difference between having flexibility, which is that your muscles are loose and allow you to move, and being hypermobile. Hypermobile is specifically referring to the fact that your joint has more movement in it than it should, right? When there's too much movement, it's unstable. The ligaments are the tissue that cross over the joint to try and help stabilize it. Now, different joints has different like movement capabilities, right? Like our knees and elbows, they really should only be bending like this. They're not supposed to bend backwards. They're just supposed to be straight or bent, right? And that's kind of their range. Whereas our shoulders can go all around, up, down, front, back, obviously we don't have as much movement backwards in our shoulder as we do forward, because this is very easy to do, but don't try it the opposite way, right? So our ligaments are there to help stabilize the joint. It means our muscles don't have to work as hard, and it also means that we don't damage the joints, right? Because you can imagine if something is completely unstable, it's flailing around, it's not going to be as well protected. With hypermobility, for various reasons, your ligaments are looser than they should be, and they're not providing the stability to the joint. So the joint has more movement than is ideal. Now, what causes hypermobility from like, why do the ligaments get looser? You can have a history of injury. If you've injured it before and it's healed, the ligament has healed slightly longer, you'll have more mobility in that joint. You can have like a condition like Ehlers-Danlos or hypermobility syndrome, which means that your connective tissue isn't supporting you the way that it should. And from what I can tell, it can just be genetic. You can have some joints that are hypermobile and others aren't. Usually syndrome is more global, but like I've had clients who their like elbows were a bit hypermobile, but their knees weren't, and so on and so forth. When I say it goes past what is ideal, how do we know what's ideal? Now, that's actually not a question I can answer because I can't find a source of like, how would you even possibly decide like, okay, scientifically, this is as far as the joints should go? Well, what I can tell you is that when we take what I was taught, which is ideal range, or we work with clients who have extra range and figure out where the sweet spot is for them to stop going past, the kind of what we accept as ideal range really works well for hypermobile people. We say, okay, don't go past this. This is ideal range. Don't go past this. It really helps. And that's like one of my main tips for you for helping if you do have hypermobility. What problems can hypermobility cause? Now, the main ones that we see is it can make you more prone to injury because your joint has more movement than is ideal. You can be more likely to be injured. It can cause joint pain. And I think mainly the joint pain comes because the muscles seem to get very tight around joints and related to movement where the joint is hypermobile in a way that it maybe doesn't necessarily get the same tightness for someone who's not hypermobile. And then also that can compress the joint. And then just like the extra movement can irritate the joint over time, right? I'm not saying that one time you let your elbow go past straight, it's going to irritate it. Over time, it can create irritation. So what can we do to reduce these problems if you have hypermobility? The very first thing I would say, and one of the most important, is Figure out what is ideal range of movement and stop going past that. And the reason that I say this is that, as you know, we have the water bucket analogy, right? You're putting water in a bucket. Water is the tension. The bucket is how much tension you can carry. So how do we take water out of the bucket? And how do we stop water from going back in? And so when people come to us and they have a lot of pain and tension around joints where there is hypermobility and we release the muscles, that's taking water out of the bucket. But why are the muscles getting so tight? So what I started advising them to do very early on is let's just stay within range. Because if we think that the reason the muscles are getting tighter is because they're trying to provide more stability to protect the joint, to stop it from going further than it should, if you stop going further than you should because you stop yourself from moving, maybe the muscles won't get as tight. And that is what happened. We found that if people stopped going past ideal, so that means stop locking out their knees backwards, stop letting their elbow go past straight. If they stopped, then the pain wouldn't come back, or it wouldn't come back as quickly. It would take much longer. And the muscle tension wouldn't come back as quickly and it wouldn't take as long. So it's difficult to do because you're basically having to retrain yourself. So like, as an example, I've recorded this video a few times and I keep using my elbow as an example and now it's starting to bother me. But I'll do this one more time. Okay. So this is past straight, right? So I generally do not let my elbow go past this. But if you watch a lot of yoga teachers, people on TV who like lean on their arm, so many people will put all their weight on their arm and the arm goes past straight so it's curved back. It's something that we don't think about. But the moment that you stop, like letting your body go past that ideal range, which is generally past straight for the hinge joints, as an example, which includes your knuckles, the pain doesn't come back as quickly, if at all, and the muscle tension takes much longer to come back. It's a little bit more tricky for things like shoulder and hip, so you can work with a little bit more care. And of course, you can always work with someone for them to kind of walk you through that. If you're having shoulder problems, if you're having hip problems, you may already be working with someone and they can go through that with you. Or you can come see us if you're in London. The other thing that you can do is stop stretching excessively and intensely. Now, if you've seen any of my stretching videos, you know that one of my big things is you don't want to overstretch. You don't want to push past muscle tension. Unfortunately, when you're hypermobile, you can be really flexible and you can actually get into positions where you're stretching. You don't feel a stretch and you're not actually stretching your muscles. In fact, you might be making them tighter. You would be surprised at the number of people I've had come in and they're like, yeah, so I can like put my nose to my knees, but I don't really feel a stretch in my hamstring, but I have this pain in my hamstring attachment. And their hamstrings quite tight, but their body just learned to compensate with their hypermobility to get into that position. And so then we have to take the stretching way back. So if you stretch intensely to try to address muscle tension that you have and you're hypermobile, you might want to check out my stretching series, my super gentle stretching video. And it just talks about why actually, if you're trying to improve muscle tension, stretching gently is better. Now, depending on how severe your hypermobility is in a joint, you might not want to stretch it at all. If you don't know that you can protect it, it's actually better to do focused releases on the muscles around the joints. And that's something we do in clinic all the time, is that we will adjust. So instead of doing like any stretching techniques like muscle energy release or anything where it's like passive stretching, we are very focused and doing neuromuscular technique or positional release on the muscle that crosses over the joint that may be tightening to try and support it. And so that's the second thing. And honestly, if you do those two things, stop stretching like crazy and readjust your range of movement for the joints that are hypermobile, you will feel a lot better. Oh, third one, strength. Do strength work, do stability work. Now, it can be a little bit tricky because if you don't have the stabilizing muscles to support you, then when you're doing strength work, you definitely can overuse muscles that will aggravate your joints. So it's really important to make sure that like your glutes are switched on, your pelvic floor is working, your lower abdominals, the postural muscles in your spine. So something like Pilates is really fantastic because it really focuses you in on your alignment. Bar can be really good, but you've got to be careful and make sure it's not somebody who's going to like throw you into your flexibility, or you got to be mindful of that. Yoga you have to be careful with because some yoga will kind of push you into flexibility that maybe is too much for your body, depending on like what your hypermobility is. Like some people with hypermobility should not do yoga unless they're working with someone who's very, very trained in structural position. Um, and so yes, so that's the other thing is that you want to be strengthening your muscles so that they are strong, so that they can support you, as well as making sure that you're releasing the muscles across the joint without like stretching the joint and adjusting the way that you move so that you're staying within ideal range. Those are the tips. Let me know if you have any questions. Let me know if you try any of them and they work or they don't work or how it goes with you. And next video, I'll be talking about Ehlers-Danlos syndrome and how we work with that and some additional considerations that we take on top of what I've said here about the hypermobility. So have a great rest of your day. Oh, I forgot to totally forgot to say. Please like and subscribe if you like it. It really helps us get out in front of more people. Please share it with anybody you know who is extra flexible or has double jointedness or hypermobility. And I will see you in the next video. Okay, bye.